And as the liver is breaking down, it forms scar tissue, and it forms what we call cirrhosis. So it's just like
all this is happening in the dark.
All this is happening exactly in the dark. So until the liver reserve is almost completely taken off or taken up, the person does not know that, you know, something is going on. And the liver is such a huge organ, like I said, it's about 1.2 kilograms. Up until it's just less than 25% of the liver left, you may never know that something is happening.
Even the yellow eye doesn't show?
No, no. The yellow eye doesn't show until...
Okay, bearing in mind that if the liver is compromised, we're talking about the compromise of glucose circulation around the body.
Yes.
We're talking about the compromise of the removing of toxic material from the body,
yes.
The compromise of some manufacture of some proteins,
yes.
And a lot of implications here we're talking about.
Yes.
So how does one go about avoiding, or can it be avoided? Can this viral hepatitis actually be avoided? How?
Yes. Okay, if we first understand how it is spread, I did mention that in our environment, it's usually as children that the infection is spread. It's a blood-borne condition, and it's spread when you have a loss of integrity of the skin or the mucous membrane lining the oral, the mouth, or the nose, or the, you know, vulva. When you have breaks or bruises or sores, and you have contact with blood from an infected person, one is able to contract the infection. Also, unsafe injection practices, not just in our healthcare facilities, even circumcisions, incisional, these are scarification marks. And
that is if the instrument is already infected.
Is already infected or has been used on an infected person without sterilizing, which is what we used to have in our villages, in our rural areas.
They just take one knife and do it for everybody.
Exactly. So they line you up, and then they circumcise all the boys at the same time, or all the ladies, you know. Even this traditional ovulectomy, tonsillectomy, the Hausas do belu. It's another way that it's, you know, it can be transmitted because it's done with unsterilized razors. Pedicures and manicures done by the roadside people.
Tattoos?
Another tattoos, unsafe tattoos, yes, okay. Of course, mother-to-child transmission is key, especially in the Asian countries, during childbirth in particular. So those are ways it's transmitted. Sexual intercourse also, yes, but it's not as pronounced as these other methods I've talked about.
Okay, so now we've spoken about the spread.
Yes.
How does one take care to avoid?
Okay, so now we live in an endemic place. I said Africa, endemic for hepatitis B. So that one is born here is already a risk factor. So one, you have to screen and make sure that you are free or you are negative, and then you take the vaccination, because there is a vaccination for hepatitis B. All right, there's none for C yet, but there is for B. And all these safe injection practices, when you go for a procedure, you insist that the needles and syringes that are used are new, and then they are disposed.
We're talking about insisting here. This is where patient rights come in. A lot of patients are really scared to actually talk to the doctor or the nurse. It's like, are you trying to tell me my job?
No, it's your life. So it's important you get there, you insist that, okay, I'd like to see the syringe that is being used. I'd like to see the vial, the injection vial that is being used. If you go to have a surgery, you insist to the doctor, or are your instruments being sterilized? If you want to have a dressing
you
done,
have an autoclave?
Yes, exactly. So those are things you do insist. And if you go for tattoos, you go to establish.
Welcome back. We're talking about hepatitis with Dr. Opeyemi Owusheni. You can call in for some of your questions. The number to call is 0808 054 2233. That's 0808 054 2233. We were talking about how to avoid hepatitis. Let's just run through it again. You make sure they sterilize your instruments, use new needles if they are disposable, the disposable kind. Then don't share needles. Go for a test.
Yes.
Take the vaccine. Yeah. Let's start with the vaccine. The vaccine is now being given to infants, children.
It's part of the program.
How long does it last? How long is it good for?
Well, technically, the vaccine is meant to last for life. Its effectivity, actually, or effectiveness, may be anything from 15 to 20 years. But most people never really need to have a booster dose or anything. There haven't been consensus as to booster doses, except maybe people that work in the healthcare system that may be exposed to a lot of blood.
Those
or
ones
blood
should
products.
take booster
So
doses.
they may have to take booster doses.
No, but technically 20 years. I mean, if a child finishes all his vaccines,
Yes.
at say 1,
Yeah.
he'll be 21 when everything is over.
No. The vaccine is for life. You know, like I've just saying, these are technicalities. People say that, oh, that the effectiveness, they say safely 15 to 20 years, but it's really actually for life.
Let's talk to Tony calling from Lagos. Hello, Tony.
Yes, good day.
Good day. Please ask your question.
Yes, like people like us that just came in midway into the program, the hepatitis, please, we want to know the causes, please.